Hello and welcome to Alluring Plastic Surgery. I'm Dr. Victoria Karlinsky. I'm a cosmetic surgeon. And first and foremost, thank you for choosing us for your cosmetic surgery. You're watching this video because you have booked surgery with us, and I wanted to take a few minutes to give you some very important information as to how to prepare for your operation to make sure that, especially if you're out of town, by the time you get to us, everything is ready, worry-free, and you have all the things prepared without having to take care of it right before the operation. Regardless of the surgery that you booked, if you are a patient who's coming from out of town, please remember that you will need to come to see us minimum the morning, the day before your surgery. So you need to plan your trip accordingly. You need to be in Miami the day before your surgery, but it has to be in the morning. So depending where you live, you're going to come in to see us the day before surgery for your preoperative evaluation. However, if you plan on doing your preoperative studies here in Miami, you will need to come minimum 2 days prior to your operation, especially if you're a patient who needs any type of specialty clearances. Remember, and I will reiterate that towards the end of the video, if you're not sure, please call the clinic and ask to speak to my nurse, Amanda. She will help you determine exactly when would be the best time to come in to ensure that everything is done according to plan without any rush and any worries. You need to plan to be with us for a minimum of 5 days after surgery. That means that the day of the operation is day 0. It does not count as a post-operative day. So make sure you plan accordingly when you can leave back home. Another thing that's very important to consider is that you cannot be alone after the operation. Either you have to have someone come with you, pick you up, and stay with you for a minimum of 48 hours before you can be by yourself, or you would stay here with a nurse or someone that you hire to take care of you after surgery. Please remember, you must have someone take care of you after surgery. You have to be picked up, you cannot drive, and you cannot be alone for a minimum of 48 hours. The next thing to consider is what type of clearance preparation you need before your operation. Remember that majority of the tests that we do are valid for 30 days before your surgery, unless it's mammography, ultrasound of your breasts. Those are valid for 1 year, and some cardiological tests may be valid for longer than 30 days. But your lab work, your EKG, your chest x-ray, and your clearances from the doctors are valid only for 30 days. So use that time accordingly to ensure that things are not expired. If you are a patient who is under 40 years of age and you have no medical problems whatsoever, you take no medication, and you're not under a care of any specialty doctor, you will not need a medical clearance. You will still be required to have valid lab work, EKG, and potentially a chest x-ray depending on your health condition. And those things will be sent to you 30 days prior to your surgery. But you may not need medical clearance as long as you're completely healthy and under 40 years of age. If you're 40 years old or more, and even if you have no medical problems, please remember you're going to need permission from your primary care doctor to have surgery in an office-based surgery center. You will need medical clearance. Medical clearance is a letter from your doctor that states that he or she has no problem with you having the operation under general anesthesia. The rest of the things will be required as someone who does not need medical clearance. Remember, lab work, chest x-ray, EKG, and again, all of that will be sent to you depending on your medical conditions. The next thing to consider is whether or not you're booked for a correct operation. Sometimes patients come in and we do have to make some adjustments. Remember that seeing you virtually on video or looking at pictures sometimes is not entirely accurate. So it's something that I want you to be prepared for, that there is always a potential that we may have to tweak your procedure the day before your surgery. There's no problem with that. If that makes you very worried or nervous, I have no problems with you reaching out to me, sending me pictures directly or arranging for a virtual consultation so that we can synchronize on the correct procedure, and this will put your mind at ease. The next very important thing to consider is for patients who are 50 years old or over. If you're 50 or over, regardless of whether you have any medical or cardiac problems, I do require that you get a cardiac clearance. It's not meant to give my patients a hard time, simply because a lot of patients in 50 or older may not know that they have a brewing cardiac issue. And if we don't have you checked, God forbid, we can have a problem for an elective operation. This is the last thing we want. Your safety is the number one concern. So please remember, you will need to see a cardiologist. Some of you may have a hard time getting in to see a cardiologist, depending on the date of your surgery or maybe pertaining to your insurance. We do have a cardiologist that we work with very closely here in Miami. And if you choose to get that clearance here, we can certainly help you arrange it. But you have to then be very conscious of the time. If your surgery is on a Tuesday, you will have to be here on Friday in order to get your pre-op and all the referrals that you need to see the doctors. So please adjust the time accordingly. That's very important. Patients who are 60 years old or more will also require, on top of the cardiac clearance, will require an echo and potentially a stress test depending on your medical history and depending on the medications that you take. Remember that no patient is a cookie cutter case. Everyone requires different things. And if you're not 100% sure, as I mentioned before, please feel free to contact us directly. All you have to do is call the clinic and ask to speak to my nurse, Amanda. She will be able to help you determine what needs to be done and in what order. The next point is important things that you need to stop minimum 30 days prior to your surgery. And that's really only one thing, that's smoking. If you're a smoker, you must stop smoking 30 days prior to surgery. Remember, if you come in and you test nicotine positive, there are certain procedures that are categorically will not be done with a nicotine positive test. So the best thing to do, the safest thing to do, is to stop minimum 30 days. And I always tell my patients, if you can stop 30 days prior to surgery, there's no need to restart smoking. Everyone knows it's not good for you. It's very bad for your healing, potential for bleeding. The risk for complications is much, much higher. So please keep that in mind. It's very, very important. It's really one of the biggest predictable factors for complications. So please make sure that you stop. Vaping is just as much of a problem, so that needs to be stopped as well. The next thing that's going to be important to stop is minimum 2 weeks prior to surgery, any anticoagulation medication or things like aspirin, Advil, Aleve, ibuprofen, any medication that falls into an NSAID family. Now, remember, you cannot stop anticoagulation medication without speaking to your doctor first. You must get permission from the doctor who manages that medication from you before you actually stop it. So once again, if you're not sure about something, please reach out to us, because if you're taking anticoagulation medication, there must be a good reason for it. And some medications, some anticoagulation medicine, may not be so easily stopped. We will help you determine if it will be okay or not okay to even proceed with planning your surgery, depending on the condition for which you're taking that anticoagulation medication for. The next important thing to determine is your BMI. If your BMI is 40 or above, that automatically means that you will not be able to have surgery in an office-based surgery center, which is what our clinic is. Remember, we know statistically BMIs that are 35 or above always have a higher risk for potential complications, and we have to do everything possible to ensure your safety. So you need to make sure that you know your correct height and your correct weight. And the last thing I want is for you to come all the way from out of town to realize that you're not a candidate to have surgery in an office-based center. It results in significant amount of money lost and time lost and planning lost. So to avoid that, please make sure either you see your doctor or you have some way to correctly measure your height and your weight. And that is all you need to understand what your BMI is. It's very easy to find. You can find it online. You can Google BMI calculator, plug in the numbers, and it'll tell you exactly what your BMI is. Once again, 40 or above cannot have surgery in our clinic. Anybody under 40 is a case-by-case basis, and we will help you determine that once you're here, or again, reach out way in advance and we can help you with that. If you are a patient whose BMI is 35 or above, even if you're completely healthy, as I had mentioned before, higher BMI patients are at higher risk for potential complications. For this reason, we require also a cardiac clearance for our patients with BMIs of 35 or above. You can certainly, if you know for a fact your BMI is 35 or higher, but under 40, you can have your cardiac clearance done at home with your doctor, or if you decide to have it done with us, remember you will need to be here minimum 2 days prior to your operation. And if your surgery is scheduled for Tuesday, you will need to be here on Friday for your pre-op visit. The next important thing to remember is if you're a diabetic patient, you must know your hemoglobin A1C. If you're a diabetic, I know that you've heard this term before. Hemoglobin A1C is a marker of how well your sugar levels are controlled through a prolonged period of time, not just 1 day or two, but over the course of months. It is a very good predictor of how well you're going to heal, whether or not your diabetes are under control or you're at a much higher risk for complications. The normal hemoglobin A1C is around 5.5. If your hemoglobin A1C is 7 or above, you're categorically not a candidate for cosmetic surgery. There are certain cases where hemoglobin A1C can be higher than normal, but once again, we will need to determine that based on your BMI, other medical problems, history, medications, and the procedure that you're getting done. So if you know that your hemoglobin A1C is above 6, please reach out and talk to us so we can help you understand whether or not this will be a problem. If you are taking many different supplements, vitamins, things that are over the counter, I do ask that you stop all of these things minimum 2 weeks before surgery. The trouble is that a lot of these supplements are not fully studied by FDA, and we don't ultimately know if some of them can potentially cause adverse reactions with anesthetics, bleeding, and so on. Certainly things like vitamin E must be stopped minimum 2 weeks prior to surgery, because we do know that this particular supplement does increase risk for bleeding. The supplements that are wonderful to prepare for your surgery are vitamin C, folic acid, zinc, and protein shakes. Those kind of supplements are wonderful, especially if you are massive weight loss patients. If you happen to be a patient who've had bariatric surgery, especially Roux-en-Y gastric bypass, not just gastric sleeve, it is wonderful to preemptively take protein shakes for a couple of weeks before surgery to make sure that you have good amount of protein on board, because that is also one of the things that determine whether or not you'll have normal healing. As you know, if you are a gastric bypass patient, your capability to absorb nutrients is substantially decreased, and that will help quite a bit. If you happen to be a patient who is anemic, remember it is extremely important that you take that into account. For me personally, a patient must have a hemoglobin of 10 or above, or a hematocrit of 30 or above, in order to be able to have surgery. If you know that your hemoglobin or hematocrit are lower than the numbers I just mentioned, please reach out to us. We will be able to determine if it's categorically no for surgery until those numbers go up, or in some cases, patients are chronically writing much lower than those numbers, and no matter what they do, it'll never go up. Those cases are exceptions, and when we get proper clearances from your either hematologist or your primary care doctor who manages it for you, sometimes it's not a major issue, especially if we don't have to do a very large operation. Again, case by case basis, please reach out if you're not sure. If you take prescription medications. Please continue to take them unless you are specifically instructed to stop. The things that are most always have to be stopped are blood thinners, as I mentioned in the beginning of my video. You have to stop your injection medication for weight loss 1 week prior to surgery. And if you're taking ADHD medications such as Adderall, we do prefer that you stop at least 1 week prior to your operation. For those patients who take blood pressure medications, there are a few medicines that we would like you not to take the day of surgery, but we will give you those instructions when you're here for your preoperative evaluation. You do not need to stop your thyroid medication, certainly none of your high blood pressure medication, none of your psychiatric medications need to be stopped either. If you're not sure, if I did not list something that you're currently taking and you want to double check, please reach out and we will confirm. I believe I went over all the most important things that you need to know as you start your preparation for the operation. Below the screen is the telephone number to our clinic. Also, you can reach me directly on my Instagram page at Dr. Karlinsky, D as in David, R as in Robert, Karlinsky, Dr. Karlinsky. You can send me a message directly into my page. I check it on a regular basis. If I don't get back to you immediately, probably because I was busy, please do not worry. I will reach out as soon as I see your message. You can also send a message to my personal patient coordinator, Sarah, at 786-719-1780. She will also be the one coordinating your surgery from 30 days before the operation. And so she'll be able to answer your questions as well. And remember, you also have Amanda, who is my nurse. She's the one who will meet you for your preoperative evaluation. She will check all the paperwork. She'll make sure that you have all the proper clearances. She will give you your prescriptions. And she's the one who'll be able to answer any of your medical questions as well. So you have all the resources available to you way before surgery to make sure that your experience with us is smooth, without any stress and without any problems. I thank you very much for watching this video. I look forward to meeting you in person, and please reach out if you have any doubts, any concerns. We're here standing by to make sure that your experience is nice and pleasurable.